Continue to introduce yourselves with your name, country, and organization, and indicate by clicking on the Menti link which stakeholder group you represent. Okay, so it's the top of the hour. I'm going to start. So welcome again to all of you. I am Professor Andrea Rother. I am head of the Environmental Health Division here at the University of Cape Town in South Africa. And we host these communities of practice. We have one in pesticides and one in chemicals. So today will be our pesticide network having a discussion. And just so that you know, in the background, we've got Dr. Natasha Lalou and Caitlin Gould, who will assist you should you have any issues. Please do go to our WhatsApp group. The link is in the chat for you if you have any technical issues. And do continue to introduce yourselves in the chat. It always helps our presenters to know where you come from. So today's discussion is going to be looking at addressing vector control challenges and also including the issues and challenges with DDT. For those of you who are new to the pesticide discussion forum, just to note that it is generously funded by Sweden through the Swedish Chemicals Agency. And the idea is to bring representatives from different regions, sectors, and stakeholder groups together to really foster a mutually supporting consortium of stakeholders to discuss various issues related around pesticides. And of course, today we're looking at vector control. We're trying to build the capacity of regulators, researchers, and NGOs, particularly in low and middle income countries, through these community of practice discussions. And we hope to achieve this by really learning from each other and sharing information and data, identifying gaps, and problem solving together. And today will be a good example of information sharing and also some solutions. Just to remember that this is not a webinar, rather it's a chat discussion. It's non-partisan, which means we may not agree with each other. However, we will respect each other's positions. The only people who will have videos on today and speaking are myself and the presenters. And the participants, we ask you to participate in the chat. And if you have a particular question and a question for one of the presenters, to please put it in the Q&A. Makes it easier for us to find. But do please have a rich discussion in the chat. So we'll have 3 questions today for an hour and a half. We'll have some polls on Menti, so hopefully you now know how to find the Menti. I see many of you are still introducing yourselves, so please continue to do so. We are, next slide, please. So we have 3 speakers today, 3 esteemed speakers. We have Basil Brooke from the NICD and South African Malaria Elimination Committee. We have Chadwick Sikaala from the Southern African Development Community Malaria Elimination Secretariat. And we have Dr. Nosiku Munyinda, who is from the SADC Elimination Aid Technical Working Group, the University of Zambia, and also an honorary member of staff at UCT. So welcome to all 3 of you. And I'm going to hand over to Basil to take us through the first question. So I will turn up, there you are. Hello and welcome. And thank you for giving of your time to present today. And I'll hand over to you. Thank you.
Well, good afternoon to you, Professor Rother, and good afternoon to all the participants and the other presenters or panelists. So, firstly, thank you very, very much for this opportunity. I know we've got a lot to get through and time is a bit pressing. So I'm going to move through this presentation quickly. I'm going to try and get it done in around 10 minutes so that there's time for questions. So, you know, whatever you see, please just keep your questions. I hope it does. I don't go through it too quickly for you. But one of the problems I had putting it together is that malaria and malaria control is complex. So it's difficult to sort of quickly explain a complex problem in a few slides, but there are not many slides. So next slide, please. So this is how we control malaria, and in fact, most mosquito-borne diseases, which is really what we're focusing on today. And what we do is we use insecticides. and we use them to target the adult phase of the mosquitoes as well as the aquatic stages of the mosquitoes. So that's, it starts pretty simply. It sounds like a simple implementation to solve a complex problem, but actually there are a lot of challenges. One of the biggest ones we are facing in South Africa, in Southern Africa, and in fact through most of Sub-Saharan Africa is the issue of insecticide resistance. It's especially pertinent in some of the major vectors, mosquito vectors of disease, and certainly in malaria vectors. Another problem we have to deal with is mosquito taxonomy. If you think about malaria vectors, for example, there are a great many mosquito species in the world. We are interested in Anopheles mosquitoes when it comes to malaria, but even within that genus, there are only a few species that actually transmit malaria. And what really matters is whether they interact with people or not. So we have to be able to differentiate the vector from the non-vector species, which is in itself, and I won't go into the details now, but it's an extremely complex problem that requires quite sophisticated molecular techniques to differentiate between these species. We then have to deal with mosquito behaviors apart from their insecticide resistance, if they have resistance, and that is we need to know a lot about their feeding, resting, and breeding habits, because that tells us or gives us information about how best we need to control those mosquitoes. So we need to know, where do they rest once they've taken blood meals? What kinds of water bodies do they breed in? Do they feed indoors primarily, or do some of them feed outdoors? These are important things that we need to know. And then, of course, I'll get to something I'll get to later about the effects of climate change, which are mostly biological in challenges, at least from the vector control side. So we also have logistical challenges. It's not easy to implement a malaria vector control program, or in fact, any mosquito disease vector control program. There are costs involved, quite big costs actually. Products are quite limited. You need very skilled personnel. You need the right equipment, and you need quite specialized facilities. So those are all things that are required for a good vector control program. Then, of course, you need technical support. You need very specialized laboratories that have very particular skills to produce the required level of support. And then, of course, we have to have surveillance systems in place, which are not easy to implement. And we have to have good monitoring and evaluation systems in place as well. Next slide, Natasha. So these pictures just give you a general idea of what we do for malaria vector control. So I'm going to hone in now, of course, on malaria vector control. So we have insecticide-treated bed nets. The top three pictures really just give you an indication of how we control adult mosquitoes, and the bottom three, how we control the aquatic stages. So we have bed nets, and then in the middle there, you'll see some spray team members being trained on how to apply insecticide to walls, and then you can see a spray team member spraying the inside of a house with insecticide, and that's called the indoor residual spraying method, IRS for short, and that is the primary method of malaria vector control, especially here in South Africa. Some other countries don't do IRS; they rather rely on mass distribution of insecticide-treated bed nets. Then at the bottom we have how we control the aquatic stages. So, new technologies are now being utilized, drones, to find mosquito breeding sites and to deliver insecticides to those sites. So there's a lot of innovation that's going on in malaria vector control now. But it's still, we try to rely on more simple methods where we can. So simply draining or covering mosquito breeding sites is an important thing to do for malaria vector control. It's something that Chadwick will talk about later, integrated vector management. And then you can see a sprayman on the right delivering larvicides to a known Anopheles breeding site. Next slide, please. So these are the important things. This is on the left. You can see the life cycle for Anopheles mosquitoes. And you can see it's not a particularly complex life cycle for an insect. It starts with the eggs that will be, of course, will have been laid in a body of water somewhere. Larvae hatch out of those eggs. They go through 4 molting stages, which we call instars, after which each larva pupates, assuming it survives, and the pupa gives rise to the adult mosquito, which is the only terrestrial stage of that life cycle. So we are targeting the larvae and the adults when it comes to vector control. Also importantly, on the right gives you just a sort of a snapshot of how ordinary rural malaria actually works. So you can see there's a breeding site, a body of water in close proximity to a village, to where people live. The mosquitoes, of course, will be laying their eggs there. Adults will be emerging from there, going through that life cycle. And then this diagram just gives you an indication of where malaria happens. So mostly those mosquitoes will be going indoors at night and biting people indoors. If they pick up sporozoites from people who, or at least gametocytes from people who are already infected with malaria, the malaria parasite goes through its life cycle. They become sporogenic. In other words, they can produce sporozoites in their salivary glands, and then they can go and infect somebody else. But generally what happens is after those adults and female mosquitoes have acquired a blood meal, they will exit the house, or they will either rest indoors, should I say, which is why the indoor residual spraying technique really works so well. Some of them will exit the house and rest outdoors. Some of them, however, will also feed on people outdoors and will not enter houses. Some of them will feed, preferentially feed on cattle or other domestic animals as opposed to biting people. And as I said, most of those mosquitoes will rest indoors if they are malaria vector species, but some will rest outdoors and also bite outdoors. So it's quite a complex transmission system. The ecology of malaria is quite complicated. And these are all things we need to think about carefully and understand in order to know how best to control mosquitoes. Next slide, please. So in South Africa, this is where we get malaria. We are now a very low incidence country. But we have endemic provinces, Limpopo, Mpumalanga, and KwaZulu-Natal. But there are only some districts in all of those provinces that are actually affected by malaria. And you can see from the map that the highest risk areas are the border regions, especially Zimbabwe and Mozambique. And then the lower risk regions are in northern KwaZulu-Natal. And the northern reaches of Limpopo province, and also some of the more easterly parts of Mpumalanga. But it is very much a tropical disease. From a South African perspective, it's a low-felt disease. We don't get it on the high-felt. And that is primarily because Anopheles mosquitoes do not overwinter well in the highland areas of South Africa. And we're very fortunate about that because that is really what restricts area to the northeast and low-felt regions of the country. Next slide, please. So when we talk about insecticides, we have two methods: indoor residual spraying, IRS, or insecticide-treated nets, ITNs. And there are various insecticides that have been formulated for use in either of those methods. So most of the older ones are for IRS, and some of the newer ones are specifically for ITNs. So in gray, I'm not sure what colors you're seeing, but what I'm seeing firstly in the darker gray are the older insecticides, the ones that are currently in use, the pyrethroids. There you can see DDT, organochlorine, the carbamate, and the organophosphates. The middle line, the one that's in the darkest color, the cyclodines, dieldrin, are completely banned. They used to be used for malaria control, not anymore. Fipronil, used in the veterinary industry a lot, but currently not used for malaria vector control. And then at the bottom, the last four lines are the newer, what we call the next generation or third generation insecticides. These are newly available. They have different modes of action from the original ones, and they were developed primarily to help us manage insecticide. And the one we are most interested in from an IRS perspective, of course, is gluthionidin. Next slide, please. So we have a problem in South Africa, and in fact, in the southern Eastern African region, also affects Mozambique and Zimbabwe, for example, and in fact countries further north. And that is this mosquito here, Anopheles venestus. It's a major malaria vector in Africa, including southern Africa. It is probably the world's most efficient vector, especially of Plasmodium falciparum, which is the worst kind of malaria you can get. And one of the reasons it's so efficient is because it has what we call intense anthropophilia. In other words, it really, really likes feeding on humans. It will occasionally bite domestic animals as well. But these adult females like getting their blood meals from human beings. And what they also do is they have this habit of multiple feeding, which means one infected mosquito can infect several people in one night. And so this mosquito is very good at causing major outbreaks and epidemics. And it can maintain, even a small population of these mosquitoes can maintain a very high rate of malaria transmission. Fortunately, they also like resting indoors, which means they are very susceptible to the indoor residual spraying method. And that really, really works in our favor. But part of the problem we've had here in Southern Africa is several populations of this mosquito become highly resistant to pyrethroid insecticides. But they have always retained full susceptibility to DDT. So that really informs how we control these mosquitoes. Next slide, please. So this graph shows you malaria incidents in South Africa from 1971 until 2012. And it just gives you a brief overview of how things have been over those decades. So you can see up until around 1996, we really had good control of malaria. And we've always thought of in South Africa that good control means less than 10,000 cases per annum, most of which are actually imported cases. Only about a third of those at any one time would have been locally acquired malaria cases. That doesn't mean there weren't problems. For example, there was a problem with anti-malarial drug resistance, chloroquine resistance specifically, in the 1980s, which meant the drug regimen had to change. But something very important happened in 1996, and that is during the years in the 70s, 80s, and 90s, we were really primarily reliant on DDT for IRS, and that really did a fantastic job for us. Because if you think 10,000 cases is a minuscule proportion of how much malaria we would have in South Africa if we weren't doing malaria control. We would have hundreds of thousands of cases as opposed to under 10,000. So DDT, which was primarily being used for IRS, was doing an important job, as of course were the anti-malarials. But in 1996, a perfectly rational decision was made to discontinue using DDT and replace it with pyrethroids. These were now becoming mainstream insecticides for disease vector control, and so South Africa was simply aligning itself with international trends. So we stopped using DDT in 1996, but you can see what was already happening, where our malaria incidence was really just starting to climb inexplicably at the time. So by 2000, we were reaching far in excess of anything we had experienced for a very long time. That was an epidemic. An epidemic was declared, and what we discovered was that Anopheles funestus, which had always been so well controlled by DDT, had reinvaded areas where pyrethroids were now being used for malaria control, and they were highly, highly resistant to pyrethroids. So we didn't know that at the time. We only discovered the pyrethroid resistance in around 2000 when we started doing the appropriate tests. And because of that high level of pyrethroid resistance, the recommendation was made to reintroduce DDT for malaria control in South Africa. At the same time, there was another problem with anti-malarial drug resistance to the sulfadoxypyrimethamine. And so the new Artemether lumefantrine regimen was introduced, and DDT was reintroduced in 2000 and 2001. And you can see the dramatic effect it had in terms of our malaria incidence. Next slide, please, Natasha. And so I'm sorry for the fuzziness of this graph, but this just shows malaria incidence in South Africa in the years to date. So from 2004 up to 2024. And you can see the massive difference we've made, where we are not really under the 10,000 in a lot of years where we would like to be. There have been some bad years, but generally speaking, we've managed to maintain control of malaria. And the way we've done that is partly thanks to the change in anti-malarial drug regimen, but mainly due to the fact that we are now currently using DDT and pyrethroid insecticides in a sort of mosaic system, where some structures are sprayed with DDT to control the pyrethroid resistant Anopheles funestus. Other structures are sprayed with the newer pyrethroid insecticides, which are much more acceptable in terms of how the communities perceive them and in terms of what they actually look like on sprayed walls. Next slide, please, Natasha. So this is where we are today. So we have what we call stratified IRS. So each endemic province stratifies where they're going to do IRS depending on the level of risk. They'll do blanket spraying in some areas, more targeted spraying in other areas where there is either extremely low incidence or no incidence. They will do reactive spraying in response to the local case. That's what we mean by stratified. All of malaria control in South Africa is domestically funded, and that's a very important issue, because the only way to really sustain malaria control over a very long time is by domestically funding the programs year on year. You can't do malaria control for a little while and then stop, because it's a very, very resilient disease, and it will recur if you stop control. So I'm sure Chadwick will touch on it as well. But sustainability is a big issue for malaria in the Southern African region. Then, of course, we have the pyrethroid resistance in Phenestus, which means we have to manage that resistance, which is why we need this mosaic IRS approach in which we use DDT and pyrethroids simultaneously. And fortunately, Anopheles phenestus is still highly susceptible to DDT, as well as to organophosphate insecticides, which is also very important. So they are technically indicated for controlling this mosquito. So this mosaic approach has really proved extremely successful for us in reducing malaria incidence in South Africa. And that's really what's enabled us to adopt a strategy of malaria elimination. So we are, as I'm sure Chadwick will tell you, one of the frontline countries in the Southern African region for elimination going forward. Next slide, please. So we have some problems coming up, though. The production of DDT is being scaled down because it is listed as one of the persistent organic pollutants, as I'm sure you know. And so we are a signatory to the Stockholm Convention, which means we actually need to phase out our use of DDT as soon as possible. But that is actually being forced by the availability of DDT, and it seems that production may stop much sooner than we thought. So we have quite recent information suggesting that we will really not be able to use DDT much longer at all. So we have committed to transition to a suitable alternative, given that we are one of the few countries that still uses DDT in public health. And we are hoping, though, that DDT may still be available as an emergency option, given that most countries are aiming toward malaria elimination. And this is a product that actually works really well in terms of controlling malaria vector mosquitoes. But we are evaluating next generation alternatives. And the one we are really focusing on now, the active ingredient, is an organophosphate insecticide called pyrimethos methyl. It's formulated as an IRS product. And the assessments we've done so far really show that Actelic is its commercial name, but this pyrimethos methyl is strongly indicated for use in South Africa. Mosquitoes are susceptible to it. It works well on all surfaces, and it has a suitable length of persistence. In other words, it retains its toxicity for at least 9 months, certainly going up to 12 months. Which is what we need, because we can only really afford to do 1 round of IRS per year for the vector control programs. So we are somewhat banking on this new insecticide to replace DDT in South Africa. Next slide, please, Natasha. So these are the other ones that are theoretically available. The clothianide that I mentioned, and that has the brand name SumiShield. Then we have a thing called Fludora Fusion, which is a combination of clothianidin and pyrethroid. And then we have the pyrimethos methyl that I was just talking about. Next slide, please. So in summary, we have an especially long history here in South Africa of deploying IRS for malaria vector control. In fact, I think our IRS program, in fact, I don't think I know, it is the oldest in the world. In fact, the technology, the methodology was developed here in South Africa. So it's one of the innovations that started here, and we have been doing it longer than anybody else. And this approach has really reduced malaria incidence by more than 95%, which is what enables our drive toward elimination. And that's really important to keep in mind, because DDT played a highly significant role in the success, especially in terms of controlling Anopheles funestus, and even more especially in terms of controlling the pyrethroid resistant Anopheles funestus. But there are alternatives to DDT now, and we are assessing them, and we are beginning to deploy one of those next generation insecticides. And it's highly likely that DDT in use in South Africa will be completely discontinued very soon, in fact. But it does depend somewhat on the availability and affordability of those next generation products, which unfortunately for us are a lot more expensive than DDT. And that's a huge consideration for any malaria control program. Next slide, please. And so lastly, just to touch on climate change, just moving slightly off topic a bit. So the evidence we have to date suggests that malaria is increasing to some of what were previously colder regions of the world, and that is specifically because of global warming. And then the Intergovernmental Panel on Climate Change predicts that by 2050, malaria may, and I think we need to emphasize the may, threaten some previously unexposed areas worldwide, and possibly cause a 50% higher probability of malaria cases. So again, it's a probability, not an actual. And they found that even a small increase in environmental temperature, and temperature really seems to be the key to predicting what malaria will do with climate change. But it's a non-linear effect on malaria transmission. And that's really because of what mosquitoes and parasites do when temperatures change. These are complex animals, and they have complex responses to their environment. So they have thermal limits in which they can operate. So generally speaking, what we found is that the life history trace of the parasites and mosquitoes have this kind of unimodal responses to temperature, which they can increase their fecundity exponentially from a minimal thermal limit. As you can see, they're tropical animals, so they don't do well in things under 15 temperatures under 15 degrees. Of course, we have low temperatures here on the Highveld, I know, and of course in most areas of the country during the winter months, which is what protects us from these Anopheles mosquitoes. But they have optimal temperatures in the mid to higher 20s, and then they have these thermal limits in the mid to higher 30s, and beyond which they really can't cope at all. So they have these ideal temperatures at which they are able to really proliferate. And that's really important, because if you just go to the last bullet point there, an increase in temperature, which means a more rapid digestion of blood. I'm talking about female mosquitoes here, of course, which increases their fecundity, it increases their reproductive fitness, which means more offspring, much higher density mosquito populations. But that only works at their optimal temperatures up to that thermal limit. But what also happens with the Plasmodium parasites is they will not produce sporozoites sort of roughly above 30 degrees. And that's also really important, because what all of that means is that you can have high temperatures and high vector densities, but no sporogenesis, which means no malaria transmission. And so trying to model what climate change is going to, how climate change is going to affect malaria is very, very difficult, because it depends on the biology of the mosquitoes. It depends on the biology of the Plasmodium parasites. It depends on what people do in terms of how they use the land and how well mosquitoes can adapt to land use. It depends on what people do in terms of vector and parasite control. So it's an extremely difficult thing to model. Climate change, climate warming could make malaria worse in some areas, and it could reduce transmission in other areas. So, you know, it's something that really has to be modeled at quite a fine scale to try and understand how climate change will affect malaria. So that's all from me. Thanks very much.
Thanks so much, Prof. You really covered a lot of important issues and a very good foundation for the discussion today, and really highlighting a lot of the challenges for us. I know I have a list of questions, but I can see that there are 6 questions already posted in the Q&A, and I really wanted to give you time to present your thoughts, and I think your last point about climate change is very important. So I'll give you about 5 minutes if you could respond to the questions in the Q&A, and then we'll have to move on to the second presentation, but you can always respond to people in the chat while we're at the next one. So I'm not sure if you can see the questions under Q&A.
I'm not seeing them. I'm seeing, oh, there we go. Okay, so let me start. Could you explain more ecological methods to control malaria, and are these methods sustainable? So there are, and in fact, Dr. Sikaala is going to talk about integrated vector management, as when you use a range of methods simultaneously that are tailored to the area in which you want to control malaria. And there are quite a few things you can do. There are quite a few ecological methods you can use. I don't want to go into the details of that now. There's a lot of innovation going on in the malaria control space in terms of trying to find pesticide-free methods of controlling malaria vector mosquitoes. But we have to keep in mind that at the end of the day, synthetic insecticides really do work well, and we don't have a lot of wiggle room, if you like, because we're talking about a major public health initiative that ultimately prolongs lives and reduces the risk and protects people from malaria. So we have to stick with what we know really does work while we look for alternative methods that can replicate the effect that synthetic insecticides are able to produce, which is not unlike looking for an alternative insecticide that is able to replicate the effect that DDT is able to produce for us in terms of public health. Keep in mind that I'm only talking about public health here and not about the generalized agricultural use of insecticides. So yes, there are ecological considerations and biopesticides that are available, and they certainly fall into the integrated vector management camp. But at the moment, we are still heavily reliant on synthetic insecticides. And Beauveria bassiana, is certainly amongst those initiatives. Could you share your experience on the impact of DDT on the health of the population where the insecticide is used? Well, as I said, you know, in recent years, we've had to rely on DDT heavily to control Anopheles funestus. And it's done a very, very important job for us in terms of controlling that mosquito, which otherwise could really create epidemics very quickly. And because Anopheles funestus is extremely common in southern Mozambique, so we are almost surrounded by a sea of malaria and Anopheles funestus. And so far, we've been heavily reliant on DDT to protect us from that mosquito, and thereby protecting us from much higher rates of malaria transmission. Anopheles funestus, by the way, is certainly not the only vector we have in South Africa. In fact, there are 4 others, but Anopheles funestus is by far the most efficient. So we rely on the pyrethroids example to help us control the others, as well as DDT. But we are always very concerned about Anopheles funestus and keeping it at bay in South Africa, because without it, you know, we would have much higher rates of malaria transmission and a much more difficult time controlling them. So DDT has certainly had a major public health impact.
So I'll just ask you to choose one more question to respond to verbally, and then you'll be able to type responses to the rest. So whichever one you'd like to.
Is there one you would specifically like me to determine the use of pyrethroids versus DDT? That one's quite easy to answer. It's really currently based on the type of structures. We use DDT on the older kinds of structures, things that might be made of cement blocks, or even mud bricks, structures, for example, whereas more modern structural methods that rely on bricks and plaster, for example, or perhaps corrugated iron, we would use pyrethroid insecticides because pyrethroids are not visible on sprayed surfaces, whereas DDT is. So it kind of limits where you can use DDT. So that's mainly how that stratification happens.
Thank you. Thanks so much. And I mean, you've stimulated so many questions, so I really do encourage you to continue typing response.
Okay.
And also, if you then switch over to the chat, there's also been some discussion there. You feel free to type. And if we have time later, we'll come back and look at the poll responses. But thank you so much again. And now
Pleasure.
we'll move on to Chadwick to take us through to the second question. Chadwick, you won't be turning on your video, I believe, because of bandwidth issues. So I will turn mine off and hand over to you. And you're most welcome, and thank you for giving of your time.
All right, thank you very much. Hopefully you can hear me. Just to confirm, my bandwidth is not very good here. Just to confirm if you can hear me, Andre?
Loud and clear. Thank you very much.
All right, thank you very much. So I think we can move to the next slide. I can introduce myself. I'll be looking at. Yeah, so as has been mentioned, my name is Chadwick Sikaala, and I'm working for the SADC Malaria Elimination AIDS Secretariat, whose vision basically is to have a malaria-free year 8 region, year 8 meaning 8 countries that the 8 ministers in 2009 came together to say that we can't eliminate malaria if we don't work together the common borders. So if you look at the right, you can see the map, as Professor Basil did mention that South Africa is one of the frontline countries, meaning that these are the countries we are hoping that in the region should be able to eliminate malaria earlier than the more countries up on the north that are more endemic than the ones below. Being aware that mosquitoes do not know any borders, they cross over. But also just to mention that we are governed by, there were 5, but we've sort of condensed them into 3 strategic objectives. One is just to ensure that we are coordinating efforts along these 8 countries to ensure that we're able to reach our goals by 2030 in accordance with the global strategies. We are also looking at advocating and sustainability. Did mention the issue of finances. That just doesn't look at finances, but also human resource infrastructure to make sure that the efforts that we are putting in place are in line. Strategically, the last one talks about organization, synchronization, and optimizing the resources that we have. This basically looks at how we do share the knowledge that is being generated within the region and beyond, and how do we put in place issues like quality control. Professor Basil did mention the issue of insecticide resistance. How do we ensure that the systems are in place within the region? And then we have policies that are speaking to what we help the region to be able to accelerate the efforts of implementing the strategy to eliminate malaria. Second slide, please. Next slide. Thank you. My sincere apology again for the blurred slide, but just to say that we ascribe, as anyone else and any other regional body, to the international norms. And then here I'm just showing the global vector control response strategy that really speaks to most of the issues that either as a region or countries we ascribe to. And we all know that the goal for this strategy is to reduce the burden and threat of vector-borne diseases that affects humans. But under this, you can see that there are 4 pillars that speaks to ensure that there is intersectoral coordination. There is engagement that I also mentioned in our strategy for the E8. The issue to enhance, to ensure that there is surveillance, to monitor whether there is resistance and how our vectors are behaving, as mentioned by Prof. Basil, but also to see how we can scale up and integrate these tools with other intersectoral departments to ensure that the approaches are more usable within the country, within the context of the ecology of the country. But of course, then we have the enabling factors. We can never do these things if there's no leadership, if we're not advocating for resources, and also if our regulatory system and normative support, which could be research, inhibiting. So all these things are important, and I'm happy that Prof. Basil's presentation as a country, we're also touching on some of these things. The next slide, please. So the next slide is really basically looking at integrated vector management. We all know the definition of IVM, which is a rational decision-making process to optimize the use of resources for vector control. And it really requires a management approach. And this means that we have to look at ways in which we are efficient, there's efficacy, and there's also ecological soundness and sustainability on how we are deploying our vector control interventions, working within the available tools and resources that we have. But we all know that there are also challenges that are faced in implementing this. I think one of them is the misconception on how we identify, how we define integrated vector management. I think it has been noticed that really mostly how countries do this is basically just maybe taking one intervention and another, and they call that intervention IVM without really looking at what IVM stands for, because it's a rational decision-making process to optimize the use of resources that are available. These resources may not necessarily be within the malaria program or the vector-borne disease program, but you may have to think around how you collaborate with other sectors for you to put up an integrated management that you use your resources optimally. The elements that support this system, as you may be aware, is advocacy, social mobilization, and the issue of legislation. We are talking about insecticide here. How is the legislation that will enable countries to be able to register, for instance, the insecticide that they'll be using. The second one talks about collaboration within the health sector, as I mentioned, and other sectors, to ensure that when we are planning, we are also using the resources, could be human or could be infrastructure or could be funding, to ensure that we use those resources with other sectors, because some of the tools that we use may not necessarily just targeting mosquitoes, but they can also be targeting other diseases. So that way we sort of using an integrated approach. And of course, evidence-based is very important. So there needs to be working with a research institution, academia, for them to produce the evidence that you can use then for you to make an informed decision. Capacity building, I think that is very important. We need the infrastructure, the resources, the human resource themselves, on how we can ensure that as we are putting our efforts together, we have the capable human resources and supporting systems to ensure that we're able to respond to the challenges that we may be facing. Next slide, please. The next slide, please, just looks at from 2010 to 2015. As been mentioned before, you can see that by then we had confirmed resistance being registered within and beyond the region of Southern Africa, the E8 countries. But then you can see that the dots in the southern part of Africa were basically a few. And really this speaks to the issue that I showed in the previous slides, where we need evidence. And as Prof. Basil did mention, basically in Southern Africa, what has been happening in the past before the issue of surveillance was really strengthened, we were basically using two types of insecticide, as mentioned, pyrethroids and organochlorines. And basically, the criteria has already been mentioned by Professor Basil, was we were using DDT for structures that might go informal or plastered, and then pyrethroids were basically used for the former, the plastered structures. But again, I think as years were going by, didn't notice that the resistance, when this surveillance was intensified, we could begin to see that there was resistance, especially that even the nets that we were deploying by then were also pyrethroid based. So that put a lot of pressure on our mosquito populations. And countries started noticing some resistance, especially to pyrethroids. Next slide. Yeah, so this next slide is just to show the latest. That shows that not only to pyrethroids, but you can see that on the chart there, that almost to all 4 different classes of insecticides, we are now having resistance across Africa, and the southern region is not spared by that. The next slide, please. So this slide is just to show how the region, the 8 countries have been using the insecticide so far. Just took a period of about 4 or 3 years just for us to look at the season. So you can see the blue shows the year, which is 2018 to 2019. The orange is looking at the next season, and then the last season is 2023, which is showing us a green coloration. So you could see, for instance, in Pyrimethos, which we call it acteric, but we know the name is Pyrimethos methyl. You can see that over the years, there's been some steady use from 2018 to 2019, and this primarily came about because of the issue of resistance that countries were noticing to both pyrethroids and some DDT. But you could see that over these years, there was some sort of consistency in using this molecule for then when we go to pyrethroids, you could see that over the years, only 2 countries maintained the use of this product, because I think from their evidence, they could see that the pyrethroids were still usable, or just that probably their resistance management strategy wasn't robust enough to be able to detect the presence of resistance to pyrethroids. Banjo-Carb, only 1 country has been using this for the past season and the last 2 seasons. Then DDT has been mentioned. The first years, most countries were using DDT. The issues of production and the issues of now noticing resistance because of maybe the same mechanism as pyrethroids, we noticed that only 1 country was sort of consistent in using that up to the last season, the other season. The new 2 molecules, as Prof mentioned, were being introduced in the market. And you could see that steadily we've been having about 2 countries that have been consistently using these over the years. And that really speaks to the issue of the costs, because the new molecules that came into the market were costly. But of course, I'm not negating the issue that, of course, there are some countries, especially the low-burdened countries. IRS is not just the core intervention, they also use nets. And I know that even in the second line, in the first line countries, they are also using larval source management. But I specifically wanted to show this graph because we are looking at the pesticides side of it all. The next slide, please. So this slide, I know that it's loaded, I can try and simplify it. So we are looking at the region in terms of how do we synthesize what the challenges are. Collectively, we look at all the 8 countries, not specifically 1. So the issue of policy making, as I mentioned earlier, How do we synchronize the planning, the budgets, and implementation cycles? This also speaks to procurement challenges. New molecules are coming in the markets. The budgets have to be adjusted. Countries have to adjust their budgets for them to be able to procure what is required for the program. And that also speaks to the issue of inadequate resources. For instance, if we want to do surveillance, operational research, the human capacity, some of the countries do have challenges in terms of the laboratory and the sector infrastructures. The other two ones, which are looking at the vertical programming and inadequate linkages, also been noticed that in some instances, this information would have been gathered if at all countries were able to work with research institutions for them to be able to generate the information that can be used for them to make decisions. Then, of course, Prof. Basil did mention the issue of innovation. Sometimes it takes a bit of time for countries to be able to adopt and absorb new technology that comes across, because, of course, we have to wait for WHO recommendations. Everybody wants to be very secure to ensure that what they are providing to the environment, to the communities itself, it's something that can be approached. The last, the below lines is just to show that these are all aligned, and challenges that are aligned to the global vector response that I did mention earlier in my previous slides, that the leadership, the resource mobilization, partner coordination, and all these research and innovation all speak to that. The key challenges that we are noticing within the region have the need to be responsive to what the global situation speaks to. The next slide, please. So, as I mentioned, what are the challenges within the 8 countries that we've been noticing? As I mentioned, sometimes there's a misunderstanding of the concept of integrated vector management. You could see that in most of the instances, the programs are working in silos. They are not operating or working with other sectors for them to ensure that some of the challenges they are facing could be addressed by other sectors. I did mention the issue of misalignment of the funding cycles with the programmatic implementation. And that also affects the issues of supply chain and related costs of insecticides. Product registration, as you saw from the South African perspective, they have to do their internal investigations to ensure that the product is safe, to ensure that the product within their environment is workable. And there are also countries that have stringent measures for a product to be registered. So you can imagine if you have resistance, let's say, to one product, and it has to take you 2 to 3 years for that product to be registered, then it means that the impact on your malaria disease is being affected by the process of ensuring that product is registered. How then, at a regional level, do we work together to ensure that these are streamlined? The other one is inadequate entomological surveillance systems that could help to make decisions such that when a country notices that they have resistance to one product, how quickly would they, how robust and resilient is their entomological surveillance systems to be able to detect this quickly enough for programs to make decisions for the next coming cycles of implementation of the IRS or whichever vector control measure they are mentioning. Prof. Basil did mention and talked about climate changes. I'm not going to labor that. He explained that very well. But you might also need to know that because of climate change, you may begin to have vectors that may necessarily begin to move from one ecological system into another, and that might also affect, the malaria transmission pattern in those regions where previously we did not have these species because of the ecological systems. Prof. Basil did mention the issues about behavior, whether they are biting outdoor or biting indoor because of the pressure of the insecticides that we're putting across, or maybe residual transmission after all the interventions have been put in place optimally, but we still notice that there's transmission. Then how do we ensure that our entomological surveillance systems is robust to be able to track that? So that also seems to be one of the challenges that is being noticed in the region. Next slide, please. But this also offers an opportunity, I think, within the region to ensure that with all this that is happening, how then do we promote innovations and being able to adopt new technologies? Now people are talking about larval source management, where you can use drones to be able to identify where the breeding sites of mosquitoes are, and how can that tool also be used to be able to be deployed or be able to deploy the larvicides within the context of integrated vector management, as it were. But also it gives us an opportunity to link programs and regional research, which we've been working tirelessly, and now we're beginning to see the fruits of this. Most of the countries within the region now are not working in isolation. They are working within, they are working with the research institutions or academia within their countries or beyond. And also we are seeing an opportunity for us to be able to speak to our policymakers the importance of some of the challenges that we are facing. For instance, how do we improve on entomological surveillance? There have been quite a number of fellowships that we've put in place to make sure that countries are promoted and have the capacity to do that. But there stands still a challenge of the infrastructure, the laboratories and the secretaries that they need to use for them to be able to do things like insecticide resistance. But of course, we are also advocating at a high level to see how countries can be able to work around their budgeting and planning and implementation cycles to enable them to ensure that their products for spraying or for any other vector control activities are in place in line with the implementation cycle. Importantly also is how do we see this opportunity to say how then do we sort of manage the best practices. We share this information, we exchange and we network to ensure that within the region we are responding and quickly helping each other to be able to deploy what necessarily needs to be done. And this has worked very well with our system of technical working groups where the countries meet together, they share this knowledge, and we are countries able to pick one or two things which when they go back and able to implement to ensure that this is done. This also helps in terms of changing of, for instance, insecticides. Once one country has a robust surveillance systems and they are, for instance, site where they are collecting mosquitoes and doing the surveillance is close to another country, the other country that doesn't have that system are able to use the results from one country to be able to change and make policies for which molecule they would need to use for that particular cycle. So that has worked very well within the region. Next slide, please.
Chadwick, we are running out of time. I'm wondering if you could just conclude so that we leave a little bit of time for people to ask you questions or for you to respond.
Yeah, I think that slide is fine. I can end from there. Thank you very much.
Thank you. And thanks so much. I mean, it's very rich information and you could have gone on, which would have been great. So I don't see any questions at the moment in the Q&A for you. You could have a quick look at the chat to see how the responses are in relation to the question. And I ask people if you can see the poll on your screen. Does your country have an integrated vector management program? If you could respond to that, and then we'll give Chadwick a moment to respond to that as well. And so I don't know, Chadwick, if you've had a chance to look at the responses to the question. in the chat. So the question was, what measures have been applied in your country or region for vector management? And there is a range of responses that have been given. Are you muted? Oh, no, you're not. Okay.
Yeah, okay. Oh, can I see? Yes.
If you click on the chat, I'm just trying to see if there's any.
Yeah, I'm there.
And then also, so I see 10 people have responded. Does your country have an integrated vector management? I also think you explained really well that lots of times countries think they have an IVM program when actually it's not really an IVM program. And I appreciated the way that you explained that. Perhaps we can have the next poll. So if the participants could give examples of where and how integrated vector management approaches have been used. So 8 of you gave responses earlier about IVM programs, so perhaps you could post there. There's a response from Fernando about Mexico. I don't know, Chadwick, if you want to comment on that.
Okay, in Mexico, there's a regulation for IVM for malaria, dengue, and other products. Mexico did not use DDT since years ago, but the problem, dengue approved 15 highly hazardous pesticides differently used as a larvicide and impregnated bed nets to prevent breeding, clean the backyard. So I'm not sure whether Prof. Andrea, whether this is a comment or a question. I think they are just trying to highlight what happens in Mexico.
It's a comment. I wondered if you wanted to comment on the comment.
All right. Okay. Yeah. Yes, you are right, and I think that's the best way of approaching. Looking at the first aspect of your comment, vector management, because then you are not looking just at one problem. You're looking at malaria and dengue. Yes, they may have differences in terms of ecology and where they breed, but I think putting resources together, there's always a convergent point, because we know that for other vectors that may not transmit malaria may also prefer to breed where malaria vectors are. So that still works. But I'm not so sure about the 15 highly hazardous pesticides used as larvicides at outside and impregnated nets. But they are, I think he's just trying to inform us to say that they use quite a different area of efforts in the context of larval source management, because I could see here that they are also cleaning the backyard, which I'm pretty sure this also means emptying any water bodies out of communities where people are staying to ensure that they reduce the breeding sites. And also nets, impregnated, meaning that 2, 3, 4, 5 different diseases can be managed by using nets within the context of IVM.
Thanks for that. Thanks for commenting on that. And thank you so much for your input. We will be sharing the slides. I know you had a couple of more slides that were useful for participants. And feel free to keep commenting in the chat. In the interest of time, we're going to move on to our third presenter, Nosiku Munyinda. And also, I think what's important is this last comment that you made, Chadwick, in relation to Fernando's post, was that we've got to be careful about not using highly hazardous pesticides, that then it becomes a regrettable substitution, to DDT. So perhaps, Nosiku, you will enlighten us about some other ways of addressing malaria control. Over to you. And thank you very much for giving of your time. Okay. We can't hear you. Go ahead.
Good afternoon, Prof. Good afternoon, Professor Rotha, and good afternoon, everyone. I think I'm having a similar problem as my colleague Chadwick with regards to bandwidth, so I'll keep my video off, and I've looked through the participants list. I think I've, just for the benefit of those who don't know me. Hello, good afternoon. Yeah, so very quickly, Prof, and everybody, thank you so much for having me in this discussion forum. And as the first point, Natasha, we can move to the next slide. Like Prof had introduced me, I'm part of the SADC Elimination 8 Technical Working Group on Vector Control, but I'm also a lecturer in the Department of Environmental Health and the University of Zambia, and an honorary lecturer in the Division of Environmental Health at University of Cape Town. So to start with, I just want to open our discussion to look at other vectors in addition to mosquitoes, or mosquitoes causing malaria. So we do have mosquitoes as well, but mosquitoes cause more than just malaria. We have mosquitoes that are causing yellow fever, that are causing dengue, filariasis, encephalitis, and so on around the world. We have house flies, we have cockroaches, lice, bedbugs, ticks. And for ticks, I must mention here that these are particularly important for agriculture implications. You find a lot of ticks in livestock, you find a lot of ticks in domestic animals, and therefore they also have to be controlled. We can move, Natasha. Next slide. And then we have rodents. So rodents also cause a variety of diseases. This part of the world, I know that we've had outbreaks of bubonic plague. Rodents also cause rickets and typhus and other diseases. So just for us to remember that the vectors that we're talking about are not just vectors for indoor kind of public health diseases, but they also cause diseases outdoors, and they also cause zoonosis as well, or diseases to do with animals in agriculture. Next slide. So the contextual aspects, and I put in this title, your PO box matters. So where you live, where you currently live really matters with regards to your exposure to these vectors and the resulting risk to vector-borne diseases. And we usually talk about socioeconomics. And around the world, this is very, very similar, that most places that you find vectors breeding are places of low socioeconomic status. So you have limited education, you have limited employment opportunities, you have limited nutrition as a result, low access to healthcare, social amenities, and increased social ills. So why are we talking about social ills? There are certain behaviors that might predispose a person to more likelihood of being bitten by a mosquito, for example, or more likelihood of being bitten by lice. So these socioeconomic factors will also lead us to the residential or housing aspects. We've heard from the two presentations before mine that these vectors will breed in certain houses, certain structures more than others. And that will also influence what interventions will be put in place in those houses. So if you have limited socioeconomic status, most likely you'll find yourself in low-cost housing, very poor housing, mud thatched houses. You might be using roofs. You won't have corrugated iron roofs. You might be using thatched roofs where more vectors are likely to breed. You might have eaves in your roofs. You may not have proper sanitation. And so because of that, you have breeding areas for these vectors to continue growing in. You might have outside sanitation facilities where you find yourselves spending more time outside even during the night. And also those are also areas for possible breeding of these vectors and so on. And then of course, dealing with this also relates to solid waste management and liquid waste management that's related to poor housing as well. And then we have environmental factors, which most of the time are outside our control. And within environmental factors already mentioned is climate variability and change. In Africa, we've been told that we don't have climate change, we have climate variability. And I'm sure you agree with me that you have different parts of Africa having floods and other parts are experiencing droughts. And if you put all that together, then the equation somehow balances. But we do have climate variability. And for vectors specifically, what's important is increases in temperature and humidity. I think quite a number of studies have shown that increases in temperature and humidity do influence the breeding of vectors, and increases in rainfall and also decreases in rainfall as well also influence the concentration of the vectors, the breeding of the vectors, but also the seasonality of vectors. We're finding that with a warmer climate, we're having vectors that used to be only confined to the time when you'd have the more hot, dry seasons being almost perennial now. So you actually don't have a break from these vectors. Throughout the year, you're going to find mosquitoes around the neighborhoods, you find mosquitoes in the houses, and I'm sure it's similar to the other vectors in other parts of the world as well. So you have climate variability. I noticed Mr. I think mentioned issues of increased urbanization and planned settlements and also regional and land use changes. We're finding more and more that it's sort of the areas that used to be agricultural area, predominantly agricultural areas, are now being changed to residential areas. And this would definitely have an impact on the issue of vector breeding. So definitely your address, your PO box does matter when it comes to exposure to vectors and the risk of contracting vector-borne diseases. Next slide, Natasha. Can I have the next slide? So I'll also talk about integrated vector management, similar to my colleague Chadwick. But in this case, I'm looking at IVM from an hierarchy of control perspective. I'm sure those of us that have done some risk assessment will know that we do have an hierarchy of controls when you're looking at risks. So even with vector management, there are measures that are being used all over the world, and we've seen different examples. I was taking note of the examples in the chat. I've seen that in Antigua, for example, they're using fogging, so a lot of space spraying. There's application of insecticides in Iran. Tanzania is using ITNs. Nigeria have IRS ITNs, but they're also doing sanitation, cleaning of drainages, and so on. And Debbie mentioned biological control as well. So from this hierarchy of IVM, we can see that if we have to think about elimination, for example, when we look at the hierarchy of control, we always talk about elimination first. So if we have to look at elimination, then definitely we're looking at anti-larval measures. And under anti-larval measures, this is where we have larval source management, which could be environmental control, as we've seen the clearing of standing water, the clearing of places where, or containers where these vectors could be breeding. And there are a lot of examples from around the world that we'll discuss. Biological control, as shown by Debbie, you do have some organisms that are natural enemies to vectors. And if you put them in the same water body, then those will eat those vectors and control the number of those vectors. And these are being used even within Africa and also other parts of the world. And then you have chemical control where you use larvicides. And under chemical control, you could use larvicides that are more sort of insecticide or more hazardous. But under chemical control, you can also use oils. There are places where you apply certain oils on the surface of a breeding area of water, and this oil will sort of act as a barrier for oxygen, and the vectors in that water body will end up dying. But of course, this has negative effects because then it kills other aquatic animals in that water body as well. So you have the anti-larval being the first line of control or management. After this, we go to the second one, which is looking at adults. So here you're looking at the adult being intensified around the world, actually. So here you have indoor residual spraying, with different insecticides. We've heard what's been used in the SADC region. And I must mention that this is very similar to what's used in other parts of the world as well, with the exception of DDT perhaps. But Asia Pacific, for example, also use pyrethroids. They also use carbamates, very similar to what we're finding in this part of the world. You have space spraying, as we saw in Antigua, for example, where they use fogging. This is mostly used for those vectors that will breed outdoor or in agricultural purposes, where you have fogging using aircrafts. And now we're seeing that even drones are used for, for space spraying. And then we also have genetic manipulation. There are certain technologies that have been developed where you can sterilize male vectors, for example, and in this way, sort of control the reproduction of that particular vector. And then lastly, we look at the anti-bites or the anti-biting measures. And this is where you're applying barriers to biting. In a chemical setup, we'd call these personal protective clothing or personal protective measures. And this is where you have the mosquito nets. And these mosquito nets in our setting and even internationally are usually embedded or impregnated with insecticides, different types of insecticides. You also have house screening. This could be screening of the windows, screening of the doors, and so on. And then you also have repellents, applications of repellents on your body. And you have various types of repellents, some a little bit more less hazardous compared to others. So you can see that within this integrated vector management, there is an hierarchy of controls, and the earlier you apply the IVM, for example, targeting the larva, the better it is, because then you're actually eliminating the vector from the larval stage. By the time you're coming to applying repellents, we've heard about resistance, we've heard about different vector behavior. These might not work as well as we should. And of course, there are issues of misuse when you start looking at personal protection. Next slide, Natasha. So Chadwick mentioned the pillars of action for IVM programs, and I won't go into all of them. I think he did a very good job going through all of them. My emphasis is actually on this multi-sectoral approach. I'm sure looking at the different measures that we've seen, looking at the contextual factors, we will notice that it will be very difficult for ministries of health to work in isolation to try and eliminate these vectors from around the world. So in this case, we have to look at broadening collaboration within and beyond the health sector. So for example, local government is extremely critical when we look at vector control or vector management. Agriculture, we've seen that most of these vectors find themselves in the agriculture sector. And in a lot of cases, similar insecticides are applied within the agriculture sector. And we do know that this is probably where you have a lot of environmental exposure of these chemicals finding themselves in water and ultimately into the food chain. And therefore, you find yourselves finding resistance to these insecticides when we try to do the malaria, for example, or the human. We have mining here. We know that mining by nature is extractive, and these mining areas usually leave a lot of breeding areas for vectors, and therefore the mining communities have to be part, or the mining sector has to be part of the IVM strategy. Housing, water, and sanitation are more obvious, but we do notice that pretty much vector control, especially in the public health sector, is left to the Ministry of Health. I was looking at the challenges, the answers that we got under challenges, and most of them have to do with funding, inadequate funding, which takes us to our next point on engaging and mobilizing local communities. So what is the role? I was listening very hard, and I was really going through the chat to see who will talk about local communities. And I think only Nigeria talked about the use of communities in cleaning up on sanitation and drainage control. Zambia, you did talk about level source management. I'm not sure to what extent local communities are involved, but this is one of the pillars, as we've seen, even as promoted by WHO. And we'll look at some examples of how communities have been used in in integrated vector management. I'm not going to go into surveillance and so on because these, I think, have been already alluded to by the previous speakers. We can move to the next slide. So just to quote something that I thought was very important from the WHO site and that publication, WHO 2017, which talks about coordination among stakeholders. And usually when we talk about coordination, we confine ourselves to the more formal stakeholders, the government stakeholders, the state stakeholders, but local communities are an integral part of this coordination. And if we mobilize them and engage them properly, working with the local residents to improve vector control and build resilience against future disease outbreaks, we are sure to plug those holes where we still have residual vector-borne diseases. Quite a number of countries, I was listening to Dr. Basil, and some countries in Asia Pacific that are almost eliminating vector-borne diseases, but they still have residuals. And these residuals, most of them are due to resistance and also the change in behavior of the vectors. So you're finding that these vectors are now changing from biting indoors to outside. So it doesn't matter how much IRS we're going to employ, it will not address the issue of outside biting behavior. It will not address the issue of agriculture diseases and so on. So community mobilization is very critical, even as we go forward and talk about IVM and the use or reliance on less high hazardous pesticides. Next slide. So I picked some examples of some building blocks to community engagement. And I saw even in the challenges that issues of training and capacity building were coming out very prominently from quite a number of our participants. So in Douala in Cameroon, in addressing yellow fever, one of the interventions that they employed was community engagement. And their focus in this one was more to do with training and capacity building. So what they did was they picked community leaders. So they picked civil society leaders, they picked civic leaders, local government leaders, traditional leaders, and they brought them to a central place and they did some training and capacity building. And we can see that here they were really trying to demystify the science behind the vectors. So they trained them in identifying the vector itself and how they could identify this vector, how this vector breeds in the community, issues of larval source management, and more importantly, they involved the community in setting priorities. So the communities themselves agreed that they would have cascade training of their community members, and they would do some environmental sanitation measures. In this case, they agreed to clean their gutters and also their drains to prevent water stagnation, and also the education of the public. So this was done with the community, by the community. The WHO and the Ministry of Health and other partners just came in to provide the training, but after that, they really let the community do their own work and mobilize themselves. Next slide. And then we come to Uruguay and Mozambique. So these two countries, one in South America, the other one here in the SADC region, looking at two different vector-borne diseases, dengue and malaria, used the communities in managing waste. So very similar approaches. What they did was they went door to door and collected tires, plastic containers, and other such containers where these vectors could be breeding. So they collected these different waste streams and took them to recycling facilities. In Uruguay, the recycling was done at a municipal facility. In Mozambique, they engaged industry to do the recycling of the plastic waste that they found in the communities, and also did the other more traditional larval source management activities. And they worked directly with the community. And it was very gratifying in both cases to see how much the level of trust the community had in the ministry officials, both from local government as well as health, and also the ownership that the community took to just continue with all these measures. And the engagement with industry also brings in the private sector. We've seen that in IVM, I was listening to presentations even from Asia Pacific, that industry comes in only at a point of supplying commodities. But in this case, we can see that industry can be engaged also in the more preventive aspects of integrated vector management. So we can see these examples from Uruguay and Mozambique. Next slide. And lastly, we're going to go to Guatemala, where they used an eco-health approach to manage vectors. And here they were looking at Chagas disease, and their focus was on low-cost house improvements. We've heard how housing is such a big issue when it comes to vector breeding as well as vector control. So within these communities, they also worked with typical very rural communities, and they found that low-cost measures such as repairing cracked walls just by plastering, replacing the dirt floors with cement-like substances or concrete, moving domestic animals outside. There were some houses where they had chicken coops, they call them chicken coops, or chicken, where they do poultry. Some people were doing that indoors, but just moving this domestic animal breeding outside led to a reduction, significant reduction in the number of vectors within those communities, and also the reforestation around the area. So they did find that some of the vectors were breeding in the more wild kind of trees. So they removed those trees, but they just didn't leave it bare. They reforested using native fruit trees. So in this case, the fruit trees are native, they're not exotic, so there's no chance of them being invasive. But also, because they're fruit trees, they also bring the benefit of giving the communities fruits. And what was also interesting in this case study was that they incorporated gender and cultural aspects into their planning as well. So this is for Guatemala. Next slide. I think this should be my last one.
Thanks, Nosiku. We've actually got 4 minutes left, so it'd be great if you can wrap up. Thank you.
No problem, Prof. So I think Chadwick still mentioned these enabling factors, but just to emphasize that these, the more preventive approaches have to be done with very strong local leadership. As we've heard, vectors differ even within a country, even within a region, and even more worldwide. So there has to be a lot of local leadership at various levels. And of course, the issue of resource mobilization and funding has to be looked at. And because we're working with communities, we have to involve people that work with communities, that understand cultural norms, that understand social norms, and the gender issues also have to be taken on board. I'll end here, Prof. Thank you. Thank you very much for your attention.
Thanks, Nosiku, and I'm very sorry to have had to move you on. My apologies. All three presentations has just been so much information. Perhaps we could have the poll while we are wrapping up. And so there is a question for you. And I think you covered some really important points. In fact, all three presenters have uncovered some extremely important points to do with vector control. And so there's a question for you from Tom about how do you actually implement a systems-based approach? And he talks about South Africa has a unique issue, and the malaria is becoming an imported disease. So I think you have made some suggestions, but I wonder if you could comment on that.
Okay, thank you. Thank you for that question, Tom. And this is really important, the how part. So the first part is actually addressing it from a leadership angle. We've seen that the vector control system, even internationally, is very well organized formally. So there are structures right from WHO, from regional levels, whether it be in Africa, Asia Pacific, and so on, where you have the regional kind of groupings. So in this case, it's really a matter of broadening the participation from the traditional ministries of health, for example. Usually you'll find that maybe local government will be involved, but even if local government is involved, it will mostly be still to do with insecticides. and just a little bit on larval source management. So it's broadening the participation on those already existing platforms and having more of the players joined. Like I said, we've had industry coming in, but more from a supply side, supplying commodities, supplying insecticides. But what if we brought in recycling industries to also join the discussion? What if we brought in waste collectors and waste transporters to also join the discussion? So it's really just about broadening the participation and including the other sectors. At a community level, also bring in community leaders. Communities are organized formally as well. Start with the leaders and they'll cascade the measures to the grassroots. I hope that answers your question, Tom.
Thanks for that, Nosiku. And you know, there needs to be a driver. I think there's so many good ideas and suggestions to this systematic approach, but there often needs to be drivers. So it was good that you've mentioned a whole list. I don't know if you want to make a comment on the poll. We've got about 30 seconds. Is there anything you want to say on the poll on the screen, Nosiku? You're muted. Okay, go ahead. Do you want to say anything about the poll?
No, Prof, but just to say thank you for all these inputs that have been coming from everybody. And it's good to see that we're already going in the right direction of trying to implement the systems approach. And hopefully we'll have more drivers at a very high level that will push the agenda to have this more systems-based approach and implement all the pillars of vector management almost equally and try to plug those holes where we still have residue vector-borne diseases. Thank you.
So thank you very much. We can go to the next slide, to the end of our presentation. Just to say thank you very much to all three presenters, to Prof. Brooke, to Chadwick, and to Nosiku. Thank you so much for your time, and thank you for Nosiku to finding excellent presenters for us. Thank you to all the participants for your input and your questions. We're making this a very rich discussion, and we've had people from all over the globe, which has made it even richer. So thank you for that. Thanks to Natasha and Caitlin in the background. On the screen, you can see 2 academic programs that UCT offers and covers aspects of pesticide use and vector control and integrated vector management. So please do feel free to apply for these courses. The master's is online. And then just lastly, please do make sure you join the discussion forum so that you can join us in our next discussion. I don't know if we have another slide with the date on it, Natasha. And you can, there we are, thank you. So our next discussion will be on the 12th of September, where we'll be looking at the WHO and FAO's document on suicide guidance, and particularly pesticides being used in suicide attempts. So please do sign up so that you can join us. This session has been recorded, and Natasha has put in the chat the link to the YouTube site. And we also have a newsletter that comes out along with our presentation. So please make sure you sign up to receive the newsletter. And lastly, there will be a digest that comes out summarizing this discussion, and we encourage you to share it with your colleagues. Thank you very much again, and please do feel free to reach out to any of the presenters if you would like to discuss things further. Thank you, everyone, and thanks again to our presenters, and have a good day.
Thank you. Bye-bye.
Thank you. Goodbye.
Bye. Thank you.
Thank you. Bye.